sa inyo muna because these are all experimental and pilot projects.
Several schools in Metro Manila will have finally resumed in-person classes as of yesterday. That's after nearly 2 years of closure due to the threat of COVID-19.
Every after class, the school makes sure to disinfect the area for the safety of everybody, in which the classroom should be vacant from 30 minutes until 1 hour.
The DepEd NCR said that they are looking into adding more schools to the pilot run, but blended and hybrid learning will still remain.
I'm glad that they have thought of this just dahan-dahan lang. Pag siya was masyadong mabilis kasi just the better part of prudence.
More than 100 schools and 700,000 learners are back in school as government starts the pilot implementation of face-to-face classes across the country. No COVID-19 infections were recorded so far, but how will safety protocols be sustained when more schools reopen? We discuss in this episode of The Chiefs. Welcome to The Chiefs. Ako po si Robbie Alampay. Kasama po natin online, Ami Pamintuan of the Philippine Star, Lucy Cruz Valdez of News 5, and kasama po natin dito sa Mandaluyong, Ed Lingao of One News. Chiefs, good evening.
Hello, good evening.
Good evening.
Happy Tuesday.
Happy
Good nga
Tuesday.
siya, 356 cases.
Oo nga.
Yes.
Lowest since July last year.
356. Akala ko yung votong Supreme Court na pinag-usapan natin.
But kumpirmado na ba?
Alam mo, no?
Well, they have taken a vote.
They confirmed that they took a vote.
Yeah, they have taken a vote, but
This
we
is
don't
on
know
the
yet
this is on the
the anti-terror
anti-terror law, but we don't know yet.
the results. Mukhang bukas pa nila lalabas.
Okay, so yung mga nakikita natin sa Twitter, hindi pa ano yun.
Depends on what you saw on Twitter. Pero ang sasabi ng Supreme Court,
Wala pa. Better wait.
it's still it's a vote pa lang.
Okay, baka si Ami baka may scoop na kayo, Ami.
Kami inside ano ka dyan?
Tinitingnan pa daw yung mga vote. Mukhang isang section lang daw yung i-invalidate. Yan ang chismis.
Oh, yun yung nakita ko sa Twitter.
Yeah, that's the one that's been going around ngayon. Na mukhang the law will be upheld except for certain specific portions.
Some
Yes.
crucial, I mean, if it's true, those are pretty crucial
Yeah.
foundational
Yeah,
portions.
you have at least two sections there that are highly contested. Section 25 and Section 29. That's on the warrantless arrest for good for 24
yes.
days and yung designation of terror groups by the Anti-Terror Council.
Okay.
Kaya
Well,
magbantay daw.
sige. Well, anyway, we'll follow the wisdom of antayin na lang natin yung official release para hindi tayo magkamali.
Tayo kuryente.
Natutunan ko yun sa school. Yun ang segue ko. Let's begin tonight with education. Let's begin tonight with Undersecretary Nepomuceno Malaluan of the Department of Education. Good evening, Yusek Nepo.
Good evening, sir.
Good evening,
Good evening, sir.
Yes, good evening to the chiefs.
Sir, matagal na natin pinag-uusapan itong pagbabalik ng face-to-face classes and it's repeatedly reported and we take that as good news, of course, na so far wala pang namomonitor na infection. No? But just to be clear about that, when we say na wala pa tayong nare-record na infection as a result of face-to-face classes, estudyante at saka teacher lang yan or are we taking into account the entire community, including parents for that matter?
No, it means the participants in the face-to-face classes. But I would like to see if and validate if that includes households. But for now, my understanding is that no participant in the face-to-face classes, direct participants have been monitored to have contracted in a confirmed test for COVID-19.
Is it an important qualification, I mean, you think? And if so, I mean, it would seem, it should be easy enough to cross-reference yung mga confirmed cases over yung where schools have reopened, no?
Yes, that's correct. And up to the households, we will know that up to the households level. Now, with respect to within the immediate community, we've had an instance of a deferment, for example, last December 6 of one or two that where the local chief executive decided to withdraw temporarily the concurrence for the face-to-face classes because of developments in the community, not in the school per se. So we anticipate that that can be a scenario in the future where there can be cases not by the direct participants but within the community, but can affect the operations of our face-to-face classes. But our confidence is that it will be similar to your typhoon signals. If we will be following the alert levels 1 and 2 as the benchmark for when face-to-face classes can be held, then it's almost like an automatic protocol that if a community falls or a school falls in a community that escalates in the alert level to alert level 3, then that will be a condition for suspending the face-to-face classes. That's different from the contingency where there will be students or teachers testing positive within the direct participants. And there are various protocols for that are in place, Roby.
Sir, these are still this is still a pilot part of the pilot testing of face-to-face. No, when you take everything into account already, the pilots in Metro Manila and the pilots in the provinces, what would you say are yung talagang dumikit na learnings that you would want to apply once we get to the point where we can really go face-to-face full out?
Well, on the positive side, we've seen a good result in our framework of shared responsibility. I mean, you've seen it. You don't just start face-to-face classes with children involved without proper coordination with the parents and local government units and the preparation that has to go before it can happen. That's on the positive side. Now, we are also having learnings on some of our protocols. Some are not part of the main protocol under the joint memorandum circular of DepEd and DOH, but some of our areas went beyond that out of their own agreements in the community with LGUs, local health, etc., such as the putting up of the plastic barriers, for example. And we've seen in the reports, initial reports, that it is causing some problems with visibility, hearing, and so on. And we also received communication from DOH that it can impede ventilation.
Yes, sir.
Can increase also the surface for contamination, and it, in fact, increases the surface area that we need to disinfect. So those things, we're also seeing some, of course, I mean, the protocols need to be checked every so often. A major common observation is that the young children tend to remove their masks every so often, and they have to be reminded to put this back on. There are also parents who, despite the protocol that there should be home-based screening, and if there is any flu-like symptom, they should not send their children to school, would still send their children to school. Of course, they will be caught or the system will catch it at the gates where they are tested or screened. But we have to remind the parents to be very strict, because what we want are layers of protection from the household to their travel to inside the schools. But I heard you mention in the introduction that the next big challenge is when we expand it to all grade levels, to all schools nationwide. And In fact, I was just in our Viber group conversation with those that are focusing on this, that tomorrow's Execom and Mancom updating, even on a holiday, will be about the anticipated key challenges that we need to respond to as a feedback from the field, because we need the information from the field really on the challenges that are being faced on the ground.
Yusek, yung nationwide rollout, are there non-negotiables? For example, will you require that all children be vaccinated first? All the students? Kasi mag-umpisa na daw by January yung pediatric vaccination to the younger children. Eh. Are you going to wait for that before the nationwide rollout?
No, the vaccination of children is not a requirement. This is precisely why we have these stringent protocols in place. But of course, that is a favorable factor for greater confidence. What is required is that all teachers and non-teaching personnel that will directly interact with the children should be vaccinated. And of course, we are also encouraging the full vaccination of the households, particularly those that are vulnerable at the households. But for the children themselves, we will not wait for the full vaccination of the children. You mentioned their bottom line. The bottom line is, one, they must pass the school safety assessment tool. And we are also have been authorized by the interagency body for the safety seal program to be an authorized agency to confer such safety seal to our schools. And then they must be in areas under alert levels 1 and 2. And we will still maintain for the expansion phase next year yung requirement of LGU Chief Executive concurrence as well as permit-based. Hindi pa compulsory ito sa mga estudyante. They still need the permit of their parents as a transition before the government declares at some point in the future that the new normal where we return to most activities, and probably at that point we can make everything compulsory again like before with respect to physical attendance. But for the expansion phase next year, our position is that we will maintain the shared responsibility framework of face-to-face classes, and therefore we will still require the concurrence of the local government unit as well as the parents. And as I mentioned, this was actually a critical framework in ensuring the smooth rollout of this pilot phase, even if it's arguably a small sample and a fairly manageable sample. But that's really what the pilot is about. In other words, you get the experience in a manageable way, preparatory to an expanded phase.
What are you finding to be the most difficult or challenging protocol to observe? No? For example, earlier you mentioned you have to figure out protocols from the time they leave the house and up to the travel and then on to school. No? But sa travel pa lang, Yusek, I can imagine that it would be very hard to actually ferry the students to and from. No? Pwede na ba sila mag-tricycle? Paano sunduan dyan? And how do we know that even during the time of travel, they're protected, di ba? So, yung mga ganun ba, what are you finding to be most challenging right now?
Well, that is anticipated to be an issue in urbanized areas and in areas where children go from suburbs to the city center, and particularly for high school. That's the case because not all barangays have high schools. Most barangays have elementary schools, and based on our data, there is still a large proportion of our learners in the public schools that are really just walking to and from the schools. So you're correct that that is an issue that we will have to deal with in the expansion phase. Right now, we are able to mobilize outside of walking, and then those that have their own transportation. I think in some Metro Manilas, there is even a shuttle service.
Yes, may
But
shuttle
if it-
yes.
if it
Gastos
goes
yun,
in
ano? Yeah.
Yes, if it goes in an expanded phase, then we will have to discuss how we will deal with the resource requirements of this. But you're talking about one of the most challenging, based on our feedback from the teachers and the schools, because we have a monitoring and evaluation tool and they're reporting every week. One observation they have is that the time that we have allotted for the face-to-face classes is just too short to maximize. In other words, 3 hours for kinder and 4 hours for higher grade levels up to the senior high school is just not enough, nearly enough time to
Parang
augment
half day lang, ano? Parang half day
distance
lang bigla
learning.
lahat. Yes, yes.
Yes, so it's like parang between in local parlance to maximize. In other words, all those efforts, and when they come to the school, you will have not sufficient time to maximize all the effort of coming back to the school.
So how do you
something
supplement? Yeah. How will you supplement
this is something
the
that
gap
we will
in learning?
Yes, this is something that we will review with respect to the time allotment with our counterparts in the DOH. This will be one of our agenda. One other concern is that now the teachers have to deal with the face-to-face and the distance learning all at the same
Right.
time, which is also although most of our teachers and students and parents welcome this, there are also certain adjustments that have to be made from pure distance learning modality to one that blends it with with physical. So those are feedback that
Right.
we're getting.
And how do you make sure that those who are at home don't get left behind? I mean, di ba, parang they have to be in step with one another as far as the learning is concerned, as far as the lesson outline is concerned. How do you make sure that, everybody's on the same level and the same, di ba, chapter of the book or, yeah.
There's equal opportunity because this is blended with distance learning. And so everyone in a class will have the experience of face-to-face in either staggered daily schedule or a weekly intervals. So there will be equal opportunity for that. And I think that is also the reason what you are mentioning, why there is really a strong support from the parents, because we have schools where 100% of the parents have given permit to their children to attend.
Yusek, I was going to say maiba ng konti, but I suspect that my question is actually related to some of the things that we're considering, innovations and alternatives. I'm reading about this new bureau being set up by the Department of Education, the new Bureau for Alternative Learning System. What's that about?
This is a reinstatement. There used to be a Bureau of Informal Education in the Department of Education. But in the reorganization, just about right before we came in, where it was on functional reorganization, like Bureau of Learning Delivery, Bureau of Curriculum Development, Assessment Learning Resources. Whereas before, it's not about those functional category, but segments of education, like Bureau of Private Education, Elementary Education, Secondary. But we're finding that we need to give a special attention to out of school youth and continuing education for those who have not, or adult education. And this is why this was reinstated to have a Bureau of Alternative Learning system. So this is intended to scale up our programs to reach out to still those that are not able to participate in the formal education.
So this is
Because-
reaching out to
Yeah.
this is reaching out to particular segments in out of
Yes,
school
that's
youth, mga adult learners, as you pointed out, and
Yes.
it's not to do with, for example, the way I read it. Yeah, exactly that. Alternative learning systems. I thought it might have something to do as well with homeschooling and so on. So it's not about the methodology.
No, but you are what you are saying now is a discussion that is ongoing in the department, how the adjustments in learning delivery during this pandemic will affect our return to the new normal. Because what we are seeing is that this will influence how we are doing our learning delivery post-COVID. For example, in highly congested areas like Metro Manila, where sometimes there are schools that have to do 3 shifts just because of the sheer number and lack of physical land or land space to build classrooms on, then blended learning may be a feature of that. But it is still under discussion, and probably the realistic time frame that we're looking at here will be the next school year, 2022-2023, where this will be now a major policy decision on whether blended learning will be a more or less a regular feature of learning delivery even post-COVID.
So Yusek, best case scenario, kailan kaya magkakaroon ng nationwide rollout yung face-to-face classes?
Yeah, as early as early next year, because the students, those that are participating in the pilot face-to-face will have their Christmas vacation on December 20. We expect all the participating schools to turn in their reports based on a monitoring and evaluation tool that we have given to them. We will consolidate it to a report, and we will be submitting that to the Office of the President. I saw the recording. It was emphasized to us in the authorization, even in the expansion. The one in Metro Manila is already an expansion of the number of pilot schools. But Malacanang has emphasized that we should not veer away from the concept of the activity as a pilot. So they expect us to report. But given the smooth rollout, we are anticipating a recommendation towards expansion. And the Secretary Briones, has already instructed all of our schools in basic education nationwide to already administer their self-assessment of our readiness tool. And those that will pass are theoretically qualified in the expansion phase as we anticipate the recommendation.
So best case scenario, mga first quarter kaya, rollout na?
Oh yes, yes. Even as early as January, if we will be have a favorable
Omicron notwithstanding.
The Omicron, we're in close touch with DOH, our counterparts in DOH, and right now the effect of Omicron with respect to our guidelines, as far as I am aware, is with respect to international travel. But with respect to our internal protocols, it is more a reminder to really strictly follow. But there is still no additionality. Now, of course, we cannot anticipate how this will turn in. But this is as I mentioned, at some point, we can compare this to the storm signal. If it becomes a problem, then it will factor into the alert level of any area. In other words, what could be your alert level 1 or 2 can be elevated to alert level 3. And like the typhoon signals, then that will be a basis for us to suspend face-to-face classes. So in other words, we are not preempting the that aspect. We rely on the technical expertise of our Department of Health counterparts in that regard.
Okay. Yusek Nepo, maraming salamat po.
Thank you, Yusek.
Thank
Thank you,
you, sir.
That was
Maraming salamat.
Undersecretary Nepomuceno Malaluan of the Department of Education. Please stay with us. The Chiefs will be right back.
Welcome back to the Chiefs on One News, and now with us is Father Nick Ostriaco of the Octa Research Group. Good evening, Father Nick, or should I say good morning, Father Nick?
Good evening, good morning.
Sabi ko nga, Father Secretary eh.
Father,
Father Doctor Secretary.
yes, Father, we heard about your conversation with the President, and siguro the President heard about your beer vaccine, kaya biglang naalok sa inyo yung ano.
Good evening. My mother was shocked. I was shocked. It was totally unexpected. I am grateful for the President's invitation to serve. However, I'm a Catholic priest. I have a vow of obedience. My life is not my own. It belongs to the Lord now. And so I declined quickly, only because I know that for me to do something like that would require the permission of my religious superiors. And it's up to them. It's not my life. My life belongs to another at this point.
Yes, Father. Well, some would even say that you refused to offer too quickly. But anyway.
You didn't even think about it. Not even pause to.
I knew my answer as soon as I was asked.
Well, Father, let me put it this way. A lot of people are still trying to figure out or grasp the full implication of Omicron. It's been a week since we heard about Omicron, and this week mukhang nag-settle down yung information coming out about Omicron. We understand the data is not yet in, but at the same time, the data that's been coming out of various studies, they do seem to be a bit confusing. One study says that it's 3 times more prone to reinfection than Delta. On the other hand, there are studies that seem to show that it's much more contagious than Delta. If you boil it all down, at least as far as we know so far, what should we take away from Omicron?
So I think what the data is saying is it's more infectious, it's more transmissible, but it's less deadly. So what that means in the Philippines is people will get sick, but they will have a headache. They will feel very tired, but they do not lose their sense of taste. They do not lose their sense of smell, and they do not go to the hospital. So if this is the case, then it's actually a blessing in disguise, because that would mean that, it would just mean that the wave would come. We would have a large number of cases, and not as much as Delta because of the substantial population immunity that we have already. But hospitalizations would be spared, and so the brunt of the pandemic would not be it would not be so as aggressive as Delta was or as Alpha was.
Father,
There was a
let me see if I
difference
can put
between our situation and the surge that's now happening in Europe, for example, because of Omicron?
No, so the surge in Europe and North America has nothing to do with Omicron. That is a Delta surge. It is a substantial Delta
Really?
surge. To give you context, yet today the Philippines reported 300, I believe, and 56 cases in the
Yes.
entire country. In the United States, we have 120,000. And this is the nature of the surge. It is a Delta surge. Yes, there may be Omicron cases in the US, but I think it's 100. So think about it. You have 100 Omicron cases and 120,000 Delta cases. So this is the Delta wave. And here in the United States, as it is in the global north, it is driven primarily by weather, by seasonality. Because you remember, transmission depends on mobility and how people interact. So in the Philippines, the levels of interaction is pretty much stable throughout the year. But during the winter time, more people will interact because they have to stay inside.
Indoors.
And as compared to outside. So what you're seeing here actually, as in the north, as in Northern Europe, and slowly moving down through the European continent, is seasonality. And as it gets cooler, people meet each other. They're not wearing masks. They're not doing minimum public health standards because they have been so relaxed during the summer and the fall. And they're not vaccinated as much as we are in terms of our cities. And so what happens is this is a perfect storm for what you're seeing in terms of a substantial winter wave.
But Father, we don't get the white Christmas. But up until your point about being less vaccinated over there, what you did describe pretty much describes what we anticipate for the Christmas season here in the Philippines. No? I mean, never mind that in Baguio we're hitting 8 degrees. Manila just had 20 degrees. People are feeling chilly, and they're in the holiday mood. Everybody is anticipating precisely that picture that you painted.
Yeah, so what we're going to see, again, so unlike in the, we have, let me back up. So with 356 reported cases today in the Philippines, the average daily attack rate is less than 1 in 100,000. For many people throughout the pandemic, this has been population immunity. So the hope is that many of our kababayans get together in the cities, but hopefully most of them are vaccinated. And hopefully they will be careful, especially if there are lolos and lolas around. And so yes, we are going to increase the mobility and the meeting. But the hope is we are meeting as the vaccinated people. What you're seeing in the United States and in Europe is that there are substantial pockets of unvaccinated people. So it's not just you have one person who's unvaccinated. You have families who are unvaccinated. And when they get together or they go to church together, then the whole parish becomes a super spreader event. And that's what we're seeing in certain places, that you're spreading within communities. So now there is the threat of the Omicron, of course, because in Norway, there was a Christmas holiday party of 70 people who were mostly vaccinated, and yet there was an outbreak of Omicron. But again, hopefully, as I pointed out, there will be an outbreak, but they'll just stay at home and they won't go to the hospital, and that will be good for the country.
But Father, Delta is still in the Philippines, and
Delta is still in the Philippines.
Delta is being blamed for a lot of breakthrough infections as well in Europe, right? Can we
Yes.
completely rule out another Delta-driven surge, another wave in the Philippines?
So, well, I mean, you can never rule it out completely, but it is really unlikely at this time, given such low numbers. Remember, the numbers have been gradually increasing over the last month and a half. So Delta has had time and opportunity to find breakthroughs, and it's still struggling. So yes, our kababayans, we will all meet with each other. I'm flying home in 10 days. And when I arrive home in the Philippines, I'm so excited to celebrate Pasko. I have to quarantine first, of course. But the idea here is we have achieved in many ways one of the best case scenarios for Christmas, right? So we have very low numbers, very empty hospitals. Makati Med reported the other day that they have no COVID patients for the first time since the first lockdown. And so we will pray that this will last through January. We will be able to celebrate together. We have to do it safely. I cannot insist that we must still wear our masks, that we have to maintain social distancing as best as possible, but we can still try to celebrate in a way we were not able to celebrate last year.
Father, a while ago, you characterized Omicron as a virus that causes more infections, but with less seriousness. Just how much less serious are we talking about here? Is it significantly less serious? I asked that, Father. I asked that because I'm trying to look for a rainbow here of some sort. I mean, because if you do get a lot of infections that are not serious at all, then you might have a bigger chunk of the population getting antibodies without the threat of hospitalizations.
Yes, I mean, there is conversation on scientific group chats that Omicron should be allowed to enter our country to replace Delta. Okay, so there are, but these are countries that have significant Delta problems. Ours is not like that at this time. But there are people who are saying, and I've seen this on group chats, it's never really said in public, that one strategy would be to allow Omicron to enter, to spread through the population, to give the population natural immunity to replace Delta. And therefore, in terms of long-term protection, it would be better. I struggle to consider public policy where we are going to intentionally allow our kababayans to get sick. Because even if it's mild, this is not like a just simple cough. This is still mild, but it's mild COVID. And mild COVID means you're not going to the hospital, but you're still feeling significant symptoms for some.
But actually, but Father, I was going to ask, precisely to your point, even if it were mild, but you have more transmissibility and therefore more people having it. Yes, mild symptoms, you're not getting to moderate or severe. But knowing how many people handle a positive test, right? Wouldn't you still run the risk of overwhelming hospitals, even if you were overwhelming them with mild cases?
Well, yeah, I mean, you can see in South Africa that most of the patients are mild. Yes, that would but that is a triaging issue. That is an issue that will have to be dealt with at the level of the hospital. And that can be dealt with, right? So you have to, if you are aware that Omicron is now the dominant variant, then you can look out to triage patients that are mild as compared to those who are at risk for moderate or severe disease. Also, this is the reason why I emphasized the antivirals in my briefing of the president. At some point, we need to move to, there will be future variants. So this is going to be a lifelong scenario that we are facing today. And so we have to begin to transition to an endemic consideration for COVID-19. And what that means now is really, accelerating the approval for molnupiravir for compassionate use in the Philippines, trying to obtain Paxlovid, even though there is still a shortage of that drug, and then begin to allow our medical professionals to triage our patients, to send them home. And you say, you are at risk, but we're going to send you home with 10 pills, and you must take 2 pills every day, 1 in the morning, 1 in the evening for 5 days, and we will not see you again. And that you're correct. There's going to be, especially in the Philippines, I think, unlike here in the US, it's in the hospital, out of the hospital. Basically, you have major surgery, they send you home tomorrow. But in the Philippines, confinement is a serious thing. They tend to be longer. But our healthcare professionals will have to adjust so that they will be able to properly manage our limited healthcare infrastructure resources with the authentic needs of our kababayans.
Father, maybe you can explain more what endemic means.
Yes.
I think that part of your presentation last night was applauded by the cabinet and the president, and you were even asked to pray afterwards. They loved your presentation. What can people do under an endemic environment when the coronavirus becomes endemic? Can we take off our mask? Can we travel again on planes without masks?
So flu is
Will
endemic.
it be like the flu?
It
Yes.
could be like flu, right? So flu is endemic. So if you want to ask what will life be like post-pandemic COVID,
Yes.
look at flu, right? So flu is an endemic disease. You will see it still kills Filipinos, di ba? So it will kill our elderly, those who have comorbidities. But what you're seeing here is that the levels of death, even though tragic, is not overwhelming the health infrastructure. So if you're asking me what distinguishes pandemic versus endemic, it is the pressure on the healthcare system. So our pandemic is a pandemic because when we have a wave, the hospitals are overwhelmed everywhere. And our healthcare workers are exhausted and burnt out and devastated. They are not burnt out and devastated by flu, right? There will be a regular cases of flu. You will vaccinate against flu. Some will not vaccinate. They will go into the hospital. This is what we imagine is going to happen with COVID. Now, we do not wear masks against flu unless we have flu, right? So unless you have flu, you are at home. And if you go out, now I think one of the things that's going to change is you will see people are going to be more mask friendly when they are sick in a way that they were not. This is the culture really of some of our Northern Asian cultures, Japan, Taiwan. They will wear masks if they're sick. And I think what you're going to see is there will be a transformation in societies around the world. Filipinos will be more, they're not so scared of masks anymore, but there will not be mask mandates. There will certainly not be face shield mandates. There will be face-to-face, everything will be face-to-face. You will simply stay at home. My prayer is by next Christmas, this is where we will be.
Father,
I was
Father,
going
on the
to
other
ask
side
you,
of that,
okay, timeline-wise, what are we talking about here? If we were to continue with the protocols the way they are now, and the way we're seeing, the curve of COVID cases, what timeline are we looking at medically?
So again, everything is dependent on appearance of a new variant, right? A new variant always changes the picture. But given what we have now, if we can sustain our vaccination rates, if we can sustain our boosting, if we can obtain enough or at least some antivirals, we will be able to return to pretty much endemic levels. Hopefully by next summer, certainly my prayer is by next Christmas. Huh?
Wow. Summer's good.
Summer is good. Remember, what has to happen for a summer is we will see these very low levels for the next 3 or 4 months. If we see ADAR below 1 in 100,000 for the next few months, if we can maintain this, and what will happen is mobility will slowly increase, and we will see if we can maintain this, and we will continue to vaccinate, we will continue to boost. Our people will, there will be breakthroughs. You will see that there will be spikes, but there will be spikes, but not the kind of waves that we've seen. And they will completely dive. If that is the case, my university here, we have 96% vaccination coverage. We have cases. They come in, we wear masks in class, but everywhere else there's no mask. And if you are in the same room, but within 6 feet, everyone can take off the mask, even if you're not eating. And we have no waves. We have not had a wave for 4 months.
Father, just a quick clarification there. You said in my university, you're not referring to the University of Santo Tomas.
No,
you're
we're
referring
talking
to
here in the US.
Okay, just to be clear about that. Secondly, in a future where COVID is endemic, what is the future and the direction for medications such as molnupiravir and Paxlovid? I mean, this will ultimately become over-the-counter meds as well?
It will really depend upon the FDA of the Philippines. Some of these will probably, I assume they will always remain prescription for now, only because, it's not a Tylenol, it's not a Tums. It's still an antiviral. And I think all antivirals today remain prescription only. And it's the same thing. And so, but you will just go to your local doctor, get the prescription, and then go to Mercury Drug or Watsons and get the prescription filled. Now, it's still quite pricey, huh? So we're dealing with several $100s for the regimen right now. Merck has allowed generics to be made, and the hope is that this will substantially drive down the price point in the global south. That's my hope and my prayer. And Paxlovid, Pfizer has not yet done a similar thing as Merck, probably because it's a first of its class. Merck is a repurposed antiviral. It has been around for a while. It was used for other things. We now know it works against COVID-19, but the Paxlovid is a brand new drug that was developed just for COVID-19. So again, it's a hope and a prayer. We will see. But as you can see, I'm very hopeful.
Father, in an endemic situation, we will need regular boosters, right? Like I remember, I think you got your Moderna in January. You've had your booster as well?
10 days ago po.
Oh, 10 days ago. Moderna as well.
Moderna, third Moderna. I was knocked out again first 24 hours to 36 hours. But it's only 50 micrograms, not 100 micrograms, which is the initial dose. So I had chills for maybe 2 hours instead of 8 hours. And then you just you take the paracetamol and then you're okay. And I took it primarily because I'm going home to see my mother, and I want to make sure that when I see my mother, I am as fully protected as I possibly can. She is doubly vaccinated, and she will be scheduled for her booster in January because it will be 6 months after her dose. But I want to protect her as much as I can.
So Dr. Fauci was quoted as saying that Americans may have to take as many as 4 boosters a year. Has that changed in view of? I'm just wondering.
We don't know. We don't know. We are hoping that it will be something like the flu, where here in the U.S. you have your annual flu shot. And I think Moderna is even thinking of producing a combined flu and COVID shot. So when everyone goes in for their flu shot, the COVID is added, right? And the flu shot is actually a polyvalent shot. So it's against 3 variants of flu. So you could imagine that every year you will get a boost, you will get vaccinated against Delta, against Omicron, and whatever new variant that appeared that year. And that will simply what will happen every year. Again, this is the endemic. It is the movement to the endemic stage of COVID-19.
So what about North America? Is it moving toward endemic situation later than we are?
It is sad what is happening here, because what is happening here is people are dying who did not have to die. People are getting very sick who did not have to get very sick, who are choosing not to be vaccinated for ideological reasons. So unfortunately, I know personally people here in Rhode Island, the winter wave of COVID-19 has arrived in my home state. And we are seeing surges of COVID-19 in our community. And unfortunately, what this has meant is that I know young people, early 50s, 40s, who have died in the last few weeks because they refuse for ideological, political reasons not to be vaccinated. And for that reason, we will lose many more deaths unnecessarily. We will not have the kind of population protection that the Philippines is currently enjoying. Because people will unfortunately not be vaccinated, and they are very proud to be not vaccinated, which I do not understand. We did not do that against polio. We did not do that against measles or mumps. But for some tragic reason, here in the United States, it's linked to a particular identity.
Father, you mentioned to the president that you are part of the Malik Scientist program.
I am a Malik scientist of the Philippines.
How is that coming along? I will ask Ed's question. How is your
Why should always come back to me when it comes to the beer vaccine?
Hello, Ed.
I mean, your Malik Scientist program, is it contributing to your R&D on the vaccine?
So the Malik Scientist program is really a designation, and I'm grateful to the Philippines that will allow me to return home to train the younger Filipino scientists, to give them the the gift that the Lord gave me in a world-class scientific education and world-class training. And that will allow me. So I go home, I lecture to Filipinos, I teach Filipinos, I will meet other Filipinos. I'm doing this now on Zoom because technically the Malik scientist requires me to return home, but I was given the Malik scientist designation during the peak of the Delta surge. So there was no way I was going home. Everything was in ECQ. So it's my hope that I'll be able to contribute to building up science at home. And Ed, to answer your question, one of the things I have said is that I always am surprised at the paperwork in the Philippines. And so I've spent the last 3 or 4 weeks trying to send biological materials to my colleagues at UST in the lab that we need to finish our experiments. We did it on our mice, but we have to test their blood. And I need to send something over, and it's actually quite difficult. FedEx will not allow me to send it without certain papers, and trying to get those papers has been a challenge. So I have reached out to as many different people in the government that I work with, and they are in their graciousness, they are trying to help me to get that paperwork done so that we can Federal Express the antibodies to the Philippines. But the antibodies are here in my refrigerator. We're just waiting.
You were speaking with somebody who could expedite that just yesterday.
Yeah, you can do everything faster if you're the secretary of health.
You were right there.
You had your chance, Father.
Wait, kailangan pa ba ng EUA niyan pagka natapos? Kailangan pa ba i-EUA yan?
Yeah.
So, I have reached out to many secretaries to try to help me, and we are trying to get that paperwork so that the Federal Express will accept the package to send it to allow me to ship it to UST.
But Father, not to complicate things with you with whoever you need to deal with, but give us an idea of the red tape as it impacts even science.
Well, so I'm trying to ship something, and so it's a matter of getting the necessary permits that will allow me that the government has to approve that I can use this. Now, these are standard biological reagents, but I need permits. And because I'm not used to the Filipino system, it's not clear to me who I should reach out to. And when I ask people, no one's quite sure who, and I've asked different people, and like I said, I'm just trying all avenues. I mean, I was told, Father, you should bribe people. I said, there's no way I'm going to bribe anyone.
But you
were already.
You didn't ask yesterday. I mean, in Malacanang,
you were already in the press
it didn't
con
occur
with
to
the
you
president.
Yeah.
Pwede mo ilagay sa magnetic lifter.
Maybe what I should do is I should attempt to ask
Attend another
for
briefing.
help. So I will, look, the Lord is my boss, and my boss can do many things, and I've asked him many times. So I'm just very patient, and it will happen. And when it happens, it will happen. And I will just go forward doing that.
Okay, Father, our prayers are with you.
Okay. Father Nick Ostriaco.
Filipino paperwork is a big challenge.
Ed's motives for the prayers are questionable.
I didn't even get to ask the question anymore.
Pray.
I don't even get to ask that question anymore.
Sabi ni Ed, Father, you may have missed it. Baka pwede raw isingit sa magnetic lifter yung mga kailangan. Pero yan ang napapala ng tanong tungkol sa beer. Sige.
Tell them I'm doing the best I can, Ed.
We believe you, Father.
Ay, nagbibiro lang po kami. Nagbibiro lang si Ed. Except about the beer. Father Nick Ostriaco, maraming salamat po.
Thank you,
Father. Thank you, Father.
Good night.
Father Nick Ostriaco of Octa Research. And that's all for this edition of The Chiefs. We hope what was discussed here will keep the conversation going. Before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Robbie Alampay.
I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Ed Lingao, and we are One News.